We're a full-service employment agency for Dorcas International. We provide a comprehensive and holistic set of intake assessment, work readiness, job training, career advisory, employment services.
The biggest strength of our department is that we don't just help our individuals get jobs.
We focus specifically on matching people's talents and interests to open job opportunities.
For those folks who need to build new skills, we have partnerships with academic and vocational programs in the Rhode Island area, and we help them sort of navigate through the admissions process.
Our employers are equally as diverse as the candidate pool. You know, we have people that go into engineering jobs or coding jobs.
We currently serve about 250, 300 people a year.
We have a whole lot of people that do things like production or hospitality in restaurants and hotels.
We have seen a dramatic increase in the number of clients filing for unemployment claims, and that is sort of the biggest challenge that we're facing right now. Many of the new arrivals and immigrants that we serve, are placed in hospitality and food service jobs, which have been the hardest hit.
The current situation with the coronavirus is affecting our clients, hitting our clients a lot harder than most people. I don't know any of our clients that have been transitioned to working from home. Everyone that I have spoken to has had their hours cut or they've been laid off. So there are so many compounding concerns for these clients that something like the 10 minutes that it takes me to file the unemployment claim is really just the tip of the iceberg of how this has even begun to affect them, let alone the prospects of them finding another job in this period of time when there's no safe transportation or no hospitality jobs or low-skilled jobs available.
Dorcas as an agency is full of mission-driven people that have amazingly large hearts and are committed to the work. And everyone has stepped up during this time.
Part of the reason why so many people have been laid off from their jobs and lost their source of income is because we've all been trying to stay home and trying to keep those who are most vulnerable safe from this spreading pandemic. And I think that prompts us to take a moment to be introspective and think about how we can monetarily protect those people who are most vulnerable, and those people are our clients.
For this community to function together and thrive, we have to help each other. So if you could donate your time or money to help us all stay together and stick together as one big community, we would greatly appreciate it. We're stronger together, and we're strong if we treat each other with dignity and respect that we deserve as human beings.
My name is Mike Che. I am the Director of Pinpoint Translation Services, a division of Dorcas International Institute. Pinpoint Translation Services provide interpreting, translation, and training services. Since the COVID-19 crisis, what we have been doing to help our community is first providing free translation to all nonprofits. The other thing that we're working on is the Dorcas International ESL Families Hotline. It provides support for distant learning for parents that are not too familiar with technologies. We are working with the state, with Highlander, to provide them with interpreting services. The teachers and the interpreter can be on a video call, and the parent can call in, and they can all communicate. For every project that our clients send to us, we have been rushing it all out without charging the client any additional rush fee. Of course, we still encourage OSI, which is on-site interpretation. But of course, with OSI, we do have to be very cautious, and we want to make sure that our interpreters' health is our priority. We have to follow strictly according to the CDC's recommendation. Stay at least 6 feet away, wear a mask, or if they are in the hospital, or at least if they know that any particular patient is tested positive for COVID-19, they can be in a separate room and just use the phone from one room to another room. What community organization can do is advocate for our services. We are still here. We are still providing translation services for our corporate client, for our community members. We are still here.
My name is Khalid Alwan. I'm the medical case manager at Dorcas International. I schedule appointment for new arriving family even before they came to America, and assign community health worker for them with the same language. We start to make home visit for family. Also, we explain to them because like the major number of our family, they use the bus. So we ask them to clean the seat, like leave distance with other people.
So they feel scared because it's the new for them. The war you fight with someone, but this one you don't see nothing. That's why they're scared. I tell them they have to prepare themselves. They have to take care of themselves. They have to wash their hands. They have to clean the house. They have to wear the gloves.
My job in the health clinic is basically like help these people to apply for something we call free care. But with all the situation, they are afraid to apply for free care because they think the hospital they're gonna call like ICE or the police because they don't have health insurance or they don't have any immigration status. So my job is to help them with all the application, and I always explain to them they don't have the right to give the information to ICE. So when I explain all this process, they get more confidence and then go to apply for this financial aid in any hospital.
Working in the hospital, you have to help everybody because everybody in the hospital is bigger and big. A lot of people ask you, where is this thing? Where is this office? Where I can find, for example, and all the time we help people to know where they go. Yeah, because I'm there for more than 2 years. I know where I go because I work whole hospital, whole building.
So how does that make you feel like helping other people?
My life, I was grow up with the helping. Mm-hmm. That's why to help everyone is in my job. I don't need it to give me nothing. I don't need all the time when I see someone need help, I help.
I think it's very good when you know this peoples or this refugees or immigrant, they need help, and when you help them you feel very happy. We try to work with Dorcas about this disease for the coronavirus. So just when this thing started here, we work with Dorcas and we had many training to make the plan about what we're going to do to help the people, to teach them how can they protect themselves for these diseases. You know, the refugees, all the refugees and immigrants, when they came to here, they don't have anything. They need help. So I ask all the people here if they can help for anything they can do. We need the help.